the outcome asked here is we want to maintain finasteride efficacy, improve libido, avoid serious shedding after switching.
The shedding after switching, if it does happen, I would argue that's almost a good sign that the finasteride regimen was not working that well. But daily finasteride, even at 1 milligram, tends to work pretty well if you look at the equivalency studies. Next question is, can you please talk more in depth on how to switch from daily finasteride to low-dose oral dutasteride, once or twice a week, maintaining finasteride efficacy, but improving libido? How to avoid shedding, switching to dutasteride, due to the time that it takes dutasteride to build up in the body?
Well, I don't think that we can promise that those things will happen. So the outcome asked here is we want to maintain finasteride efficacy, improve libido, avoid serious shedding after switching.
The shedding after switching, if it does happen, I would argue that's almost a good sign that the finasteride regimen was not working that well. But daily finasteride, even at 1 milligram, tends to work pretty well if you look at the equivalency studies.
Yeah, and I think you could do a simple, I don't think you would necessarily want to overlap these treatments. I have done that if people are using a topical product and they want to try and avoid a shed. Yeah, maybe they will go ahead and overlap those by a month or so to minimize the hormone fluctuation. Medication changes in general can cause hair shedding even when they're not necessarily hormonally mediated. So I would say to someone in this circumstance, hypothetically, and probably just go ahead and make the swap, start very low. And then, you kind of take a step back, but then you're probably going to be taking 2 steps forward in terms of your hair loss prevention or hair growth.
Yeah, definitely so. The other point to this is, again, in the other podcast that we linked earlier, we've talked at length about the different isoenzymes of 5-alpha reductase and how at an equivalent dose of dutasteride, let's say you're decreasing your serum DHT by 50%. If you compare that to the same dose of finasteride that does that, then theoretically, and if you look at the abundance of literature on PFS and finasteride syndromes and the infrequent literature on dutasteride syndromes, both theoretically and according to those studies, you're a lot less likely to get side effects. But I would say if you're having side effects from daily finasteride use, perhaps at 5 mgs, it's more common. At 1 mg, it's probably 10 to 20% of individuals. Then finding whatever is causing that is step 1, and then potential switch to dutasteride would be step 2.
Yeah, that's a good point. Finding out what someone is, do they value, and how big is the decrease in libido? Is it a 10% change, 90% drop? If it's a 90% drop, I'm saying, hey, take out the finasteride completely, figure out what's going on here, see if the finasteride is affecting this at all before thinking about throwing in another potential confounder.
My patients that have had good luck with the switch, that have what I'd consider moderate to severe side effects from finasteride, do best completely eliminating finasteride, starting an alternative regimen to control hair loss, where, it could be literally a combination of anything, shared decision making, and then starting very low doses of topical dutasteride, and then higher and higher doses, and then very high doses of topical dutasteride. They let that slowly go systemic. Again, that slow shift. And I've seen patients with moderate to severe finasteride side effects tolerate very high dose topical dutasteride where it's going systemic, and then work their way up to oral dutasteride. So it's the putting
a gateway drug.
Yeah, it's like a gateway drug, or I was going to say very gently and slowly dipping your foot into icy cold water.
Yeah, that's a better analogy.